There are three main reasons why a patient will ask you a question: for information, for clarity, or to voice a concern. Knowing the answer to a question is, of course, important, and every healthcare professional wants to help. But how do you know you've answered it for the patient? Well, you have to check back and ask. In this short video, I'll give you useful ways to check back. In our survey for this year's Urology Awareness Month, 55% of men said that they would be more likely to talk to you about erectile dysfunction if you invited them to ask questions and raise their concerns about treatment and side effects. So here's the simplest check back. When a patient wants more information, give them a bite-sized chunk of it, and then ask, is that okay? Does that answer it for you? Doing this will also mean that you don't give too much information all in one go. What about a check back for clarification? For patients with urinary tract infections, 36% of those surveyed said they would go and seek a natural remedy or go to a pharmacy. So if you're giving advice and want to clarify that, you could check back with, does that help? Does that make sense? If a patient raises a concern or a doubt, you will hear it in the language and tone of their voice. Here the check back could be, does that reassure you? Does that ease your doubt? And if the answer's no, then you're aware that you need to respond further. There is another reason why a patient may ask you a question, especially when stressed, and that's to test you. Here you may not always want to check back. Instead, for the difficult conversations, use a simple ABC. A is for acknowledge the difficulty. I understand your concern. B is for the verbal bridge, what I can say. The verbal bridge is always present tense, positive language. What I do know, in my experience, what I see. And then you can get back to the C, to communicate and contribute to their understanding. Find a few check-back phrases and verbal bridges of your own and see how they can work the next time you speak to a patient.